Fran is here!
Alice, we finally got it working.
Look, it's 2020. Of course I can't use Instagram Live. It's fine. It's totally fine. How are you, Dr. Fran?
Yes, I'm okay, thank you. I'm glad we finally got there. Any of my former clients will know that I'm a bit of a technophobe as well, but we've made it.
You know, you started the live before I did, so I think you're actually more technically advanced than me, Fran. Now, are you purposefully sat in front of lots of books to make you look knowledgeable?
Always, yeah.
Amazing. Right, so I've got a glass of wine, and I hope other people have. Hello to everyone who's joining us. Welcome to our first Lowdown Instagram Live with the amazing Dr. Fran, who's been helping us, basically with the site, with also providing appointments to our users, and it's just been an all-round amazing person to join us the last couple of months. So thank you, Fran, for being incredible.
Thank you, Alice, for giving me the opportunity to be part of the Lowdown.
Do you want to tell everyone a bit about yourself, like where you come from? What's your name? Where'd you come from?
So I'm Dr. Frances Yarlitz. I'm a GP and I live in Rotherham and work in Sheffield. I spend most of my time training in Cardiff before I move back up here, which is my hometown. And because I've got an interest in women's health, contraception, I've done some extra training in that, and that's how I stumbled upon the Lowdown and yourself, Alice, and decided to get involved with such a fabulous idea.
So how long have you been a doctor for?
So since 7 years now, 7.5 years. And I often have to tell my patients that I am old enough, even though I still look about 15.
What's the weirdest thing that anyone's ever come to you about?
This poor young woman once came to see me trying to explain that she'd woken up and everything was wet in her bed after she drunk a bottle of wine, and she just didn't understand what had happened, and I had to explain to the poor woman that I think she'd actually wet the bed.
Oh, brilliant.
That's general practice with everything.
Just like every single thing under the sun, I imagine. 1 minute it's old people, then it's young people. Yeah, great.
Very job. That's why I love it.
Well, I also wanted to introduce the skull that's behind me. This is a skull that my boyfriend bought. We went to Glastonbury one year. It constantly sort of popped up whenever I'm on a video call. Sometimes I make it look like I've got horns.
What animal is it, Alice?
I don't know. All I know is that it was a complete mistake, and it's never going to leave our house. So, thank you, Mr. Scott. Right, we've got so many questions for you, Fran. I hope you're ready.
Oh, excellent. I hope I can actually answer them.
We've got loads of questions about the pill, so let's start with something. Hello to everyone who's joining us. Okay, let's start with love the Lowdown. Thank you from Caris Ramsey. My main question would be, in terms of the combined pill affecting mental health, how can one be better than another? Would a switch only be based on, I think this was also our app last night. So, we talk about people's reaction to the pill. And is it scientifically possible to match a pill to someone's natural hormone levels?
That's a really, really interesting question, Caris. So it's an area which hasn't been researched that much, to be honest. And there's a real difficulty with that. If you imagine a lot of women go on the pill, and to be able to study its effect on mood properly, we need to just make sure that we have women who are all very similar and no other factors adding into their life other than the pill, which may or may not be affecting their mood. The difficulty is we have life, we have work, we have relationships, and all those things can impact your mood. But it's very easy for women to think, oh, but I started the pill and that's possibly the mood as well. So for those reasons, it's very difficult to research this properly, and that's one of the reasons why it's not been looked into very much. It's also very difficult for women to identify whether it is the pill or whether it's a multifactorial cause of lots of different things causing the mood. In terms of the second part of that question, that is really interesting. And I don't know if you've heard much about this, Alice, or thought about it, but that would be the future.
Yeah.
Can you imagine if AstraZeneca or Pfizer decided that we could start testing women to find their ideal birth control?
Yeah. I mean,
it would be brilliant.
It would be amazing. And I know that there's some startups out there who are working on it at the moment. So I'm excited to see what we're up with. So I've had a look at some of the evidence around contraception and mental health, and it's a bit contradictory, isn't it, Fran? Some of it says yes, some of it says no. Do you have any?
I think certainly for some individual women, they come and they say, I have started taking this and now I feel like a completely different person. And then they stop taking it and they feel back to normal. And in those women, undoubtedly, it seems like there's been a cause and effect from the pill. But how we predict which women are going to be affected by that, we just don't know. So you just have to try. Some women are very sensitive to the progestogen in the combined pill. Why that is, it could be due to your own genetic makeup. Some women have more receptors in their body for the different types of progestogens, so it affects them more. But we've got no way in telling which women that's going to be, so they just have to try the pill.
Yeah.
There are certain pills we know that might be better for those women. So, for example, an anti-androgenic pill like Yasmin or Lucette, they're often better for women who have mood changes. But then again, it's trial and error, you just have to see. It's something which I would love to see properly designed large research studies into. It's just A, getting someone to be interested in that, to be able to do it properly, and B, finding some funding for it.
Yeah. Well, 400 million women using hormonal contraception, it's not enough, Fran. No one cares. It's just not enough people.
That's what we're here to change, Alice.
Yes! Woo! Right. Cool. We talked about mental health. All right. Dr. Fran, let's keep on the pill for a bit, because I know a lot of our users use the pill. What are the long-term impacts of the combined pill? And should we take breaks? I've been on it for 12 years. With no break. I go to the doctor and they say, don't fix what isn't broken.
Okay. That's interesting. The don't fix what isn't broken. That's one way of putting it. That if there's a woman who is thinking about changing their contraception and wants to talk about different options, you should be able to talk about your different options. It's your body. But the long-term effects, so they're very small risks, but they are risks that you should be aware of, you should be spoken to about when you start on the combined pill, and they're definitely available in the long, lengthy leaflet, which you get stuffed in the little box. They include, now this isn't meant to scare anybody because again the risks are very small, but there is an increased chance of cervical cancer and breast cancer when you use the combined pill. However, you have to offset that with the fact that it can protect you against ovarian cancer, womb cancer and colon cancer. And if you actually stop taking the combined pill, your risk of the breast cancer and the cervical cancer goes back down to normal for what it'd be for anybody else within 10 years. So that's one of the long-term effects. And the other thing can be blood clots, so in the legs and the lungs, but that's a sort of a risk profile depending on a lot of individual factors for every woman. In terms of needing to take a break, no, there's no evidence that you need to take a break from the pill. It's completely safe to take as long as nothing about yourself changes. So as you get older, if you decide to take up smoking, that might be an issue. If you develop new medical problems, that's another issue. And that's why we review the pill so regularly for women who are taking it, to make sure that it's not having any long-term effects for you as an individual.
Yeah. I get it. And like, if you're on it for that long, I guess your body's changing more than your body's more than it.
Yeah, exactly. And a lot of people worry that I hear quite a lot of women saying, but is the pill masking anything in me? For example, PCOS, so polycystic ovarian syndrome, or endometriosis. But actually, even though they may be masking the symptoms, they are treating the symptoms, and that's beneficial for you.
Yeah.
So in terms of the long-term effects of those conditions, the pill's actually good.
Yeah. I know you should call it PCOS. Is that what people call it now?
Well, that's what I call it.
Is this after that podcast with Rose and she called it that?
No, PCOS, it's just medical. We call it PCOS. And the interesting thing about polycystic ovarian syndrome is that you don't actually have to have well, they call them cysts, but actually they're follicles. You don't have to see those on ultrasound on the ovary because it's a syndrome. So it's lots of other things we look at. But the combined pill is very, very good for women who suffer from PCOS.
While we're on it, what is PCOS?
So polycystic ovarian syndrome, it's a syndrome, and frustratingly, as with a lot of things in women's health, we're not quite sure why it happens.
Okay.
Could be environmental, it's slightly hereditary. So if your family suffer from PCOS, you're more likely to. Yeah. And it's made up of a few things we see. So one of them is you can have little follicles that you see on the ovary. The other thing is you have irregular periods. So some women may only have a period once a year, once every 2-3 months. And then it's also associated with what we call androgenism, so having more of the male hormones in your body. And that can come out with having things like acne, too much hair, change in skin pigmentation. And then if those things all together, so you need to have 2 of those to make up, and then we can diagnose you with PCOS.
Interesting. And what does contraception do if you've got PCOS? How does that impact your PCOS?
So it's good for you if you have PCOS and you don't bleed at all for a year. It's safer for you to be on the pill so your body can have a withdrawal bleed every month, even though it's not real period. And there is some evidence that it actually protects your fertility as well by being on the pill. Because
there's a slightly increased ovarian cancer risk, isn't there, without bleeds? Is that right?
Yeah, minimal though.
Minimal.
And it's a very common condition, and a lot of women might not even know that they have it.
Yeah.
It's one of the frustrating things with it is it can be associated with some weight gain and difficulty to lose weight, and that's because how the hormones affect the insulin levels in your body as well. So one of the things we sometimes do, even though it's not licensed technically, is start women on a diabetic medication called metformin.
Oh, right.
Yeah, which can help women get pregnant if they want to with PCOS.
Fascinating.
Yeah.
So you might think, oh, have I got PCOS if I'm feeling a bit hairy? Anything?
Yeah, so acne, hairy, irregular periods.
Yeah. Okay.
So irregular periods or skipping them. That's when we want to investigate.
Yeah. Great. Thanks, everyone. Feel free to throw comments and questions into the live chat, please. Kushti Blick, she cleared PCOS with acupuncture, herbal tincture, and stuff. Which sounds great.
That's amazing. And again, we don't know much about these alternative therapies in trying to help women because they're not things that are heavily researched, but it's really interesting to know that it can help some women.
Faith Arbucks drops in and says, I think this is one of the questions. How reliable is natural cycles when you take your temperature? I can't imagine it's all that effective, but it must work.
So natural cycles, I have a bit of a love-hate with. So for some women, it could be fantastic. You're not having to take anything artificial in your body. You're not having any hormonal side effects. But it depends very much on the woman. I'd say if you are in a stable long-term relationship, if you know your body and your cycle really well, and it wouldn't be the end of the world if you were to fall pregnant, by all means try it. And there's lots of different parts of it. You can track your cycle. So you need to have a regular cycle to know when your ovulation is. And you can use the basal temperature check, but you have to do that as soon as you wake up in the morning, same time, without moving, because that can affect things. So it's not always the most reliable. And you can also add in things like checking your cervical mucus, which can change throughout your cycle, so shows you when you may be ovulating. But again, that involves having to get quite intimate with yourself to check, and not every woman's interested in that. If you have perfect use, it varies for different apps, but some of the apps can have up to 10% success rate, which does, however, mean that about one in 10 women may fall pregnant every year using the method.
Okay.
If you are a, young 18 to 25-year-old living your best single life, it may not be the best method, just because you're losing all the spontaneity of sex, really, and then you may end up having a bit, I don't like to call them accidents, but you may end up falling pregnant. And if you don't use it perfectly, there's a failure rate of about 1 in 4 women every year.
Yeah. And what I've recently discovered about natural cycles and some of these methods, you're really just saying, assuming you might not have sex in your period, which loads of women do, because that gives bias for some reason. I don't know why. I don't know. Please comment if anyone else has had the same, but something about having sex on my period just makes things go not great. So say my period lasts a week, or I'm premenstrual a few days before I don't want to have sex. And then I'm ovulating and really fertile for maybe 9 days a month. You're really only doing these methods to not be able to use condoms for about maybe 9 or 10 days a month.
Yeah,
that's really what you're doing it for. The other times you've got to use condoms, or you can't have sex because you get bias.
Yeah, and so that's why it's an individual choice. It may fit some lifestyles, but it may not fit others.
Yeah.
And you have to have a really good think about it as to whether you would be happy with choosing your sex life like that, or what would happen if you were to have a happy accident. Would it be the end of the world for you, or would it be something that you'd want to continue with?
Yeah. I'm just looking at the questions to see if there's anything else on natural cycles. I think another question. Or we can move on to the coil, our top method of contraception. On the Lowdown, the hormonal IUF, ranked consistently top in terms of overall satisfaction on the Lowdown. Lucy Riach asks, I have had a Mirena coil for 18 months now. I thought that the hormones just affected my reproductive system. But, yes, coil, Faith wants us to talk about.
It's a method.
Lucy says, I thought that the hormones just affected my reproductive system, but I wondered if they affect the rest of me too. I seem to be having mood swings and very low sex drive, so I wondered if this could be down to the Mirena coil.
Yeah, could be.
Could be, yeah.
Could be. It's meant to be one of those. Well, it is. It's a lower amount of progesterone going through your body every day. For example, in the mini pill, you're taking 75 micrograms of a progestogen. In the Mirena coil, you've only got 20 micrograms coming out. So it's and it's meant to just work locally around your uterus. Yeah. But inevitably, in some women, they are so sensitive to the hormone that you do get the hormonal side effects, unfortunately. Yeah. And with you having had it for 18 months, I would expect things to get better between 3 to 6 months. If this is still persisting and making your life miserable, go and talk about changing your method, possibly try a non-hormonal method like the copper coil instead. Yeah. But yeah, it's too simple to say that the Mirena coil or the hormonal coil will not affect everyone, will not affect your body everywhere else. It's just too simple, because for some women it does. Yeah. And I think that's what's interesting about it, though. It's got levonorgestrel in it. It's a very common form of progesterone, which is used in both other combined and mini pill. But it is so less because it's in your womb. It's really interesting. Ellen has swooped in. She's got some questions about, I've recently come off the combined pill and I'm worried what might happen to my skin and periods. How long does it take for things to get back to normal, and what should I do? Before I let Fran swoop in, it's really interesting. We ask women on our review form, how long did it take you to finish taking a method? How long did it take for your period to get back to normal? And hopefully what Fran's about to say backs up what I'm about to say, which is that the pill actually has like the quickest return to fertility. So most women see things get back to normal within a couple of months of stopping it. But
in terms of their periods coming, their version of normal. Everyone's different, you know. Normal is very different for lots of people, but Fran, do you add anything to that?
Yeah, no, you're exactly right. Everyone is different. You should expect your regular cycle to be coming back within 3 months. You may find it's a little bit irregular to start with. If you have a prolonged period without a period, that's when you would want to go and speak to your doctor, because as we mentioned earlier, sometimes the combined pill can mask some really common gynecological problems that then you might want to look into. Yeah. In terms of your skin, don't be surprised if you had a slight flare when you stopped, but then things start settling down. And that will depend on what your skin was like before you started the combined pill as well. If you're someone who suffered with acne before, you may get a slight flare when you come off it, because of the estrogen is normally so beneficial for your skin, and you're losing that.
Yeah. And I think that, Stacey Benson's popped a question in, saying, you know, she's been on and off the pill. She's worried about coming off it. I hear this from so many women say, really worried about coming off it because of my back. Is there anything I can do when I come off the pill from getting spotty again?
Yeah, it's really difficult, because I think we've spoken about this on our podcast, that a lot of women start the pill in those teenage years when your skin can be affected. And then you don't know what's going to happen. If you're on the pill 10, 12, 15 years and you come off it, your skin might be glorious because you've gone through those teenage years and your hormones have started settling down themselves. If, however, they haven't, there's lots of things you can do to treat acne. There's, we call topical treatments, things you put on the skin that you can get prescribed. So antibiotics that you can put on your skin, and things like benzoyl peroxide or something called adapalene. They work by drying your skin out to prevent the spots. And then there's other treatments. So you can actually take antibiotics long term to suppress the acne, or even go on to stronger things which are only prescribed by the dermatologist. The really popular one called Roaccutane, which actually, it's a magical drug. The problem with those is it depends why you've come off the pill. If you've come off to get pregnant, then a lot of those you can't have when you're trying to conceive. So that comes the little catch-22. But the good news is that when you get pregnant, you'll end up with that lovely pregnancy glow when the hormones start improving your skin again for a short while.
And I think just to wrap up that kind of, you know, coming off the pill, Faith says, I've been on Roaccutane and it's skin, which
it's a wonder drug.
Is it? How many people do you think are on it, Fran? Millions?
Oh, I'm not sure about millions. I worked in dermatology for 4 months, and there was a constant stream of people who are starting on it, often young women. And part of the treatment they'd tried before would be topical treatment on the skin, antibiotics, and often the pill, the combined pill, as a way to try and improve the skin before they went on Roaccutane.
Wow.
But it's if you do happen to fall pregnant on it, it's really damaging to a growing embryo and fetus.
Oh.
So you have to sign a waiver to say that you will be on contraception or not get pregnant while you're taking it.
Wow. I didn't hear that.
Yeah, it's just another thing that being a woman changes your healthcare.
Is there an ideal timeline for coming off the pill when you want to start a family? I heard about a fertility boost immediately after taking it. Is it true?
I've never heard of such a thing, the fertility boost.
No.
For most women, if you're on the progesterone-only pill or any progesterone-only method other than the injection, as soon as you stop it, you're good to go and your fertility comes straight back to normal. The combined pill, theoretically, your cycle is meant to come back straight away. You're meant to be fertile as normal. But in a minority of women, it can take a little while for the cycle to come back normal again. My advice would be just don't get too stressed out about it.
Yeah. It
will happen when it happens.
Yeah.
But just give yourself a bit of a break with that.
And Mandy's popped in and said, how long will the cycle be to still be normal? The period every 6 months?
So I'd expect a normal cycle can be anywhere from about 23 to 35 days. So 6 weeks is pushing the edge of long. it also depends on the history of how long have you had periods like that for. If your cycle has always been regularly 6 weeks, that's probably just you. If, however, it's been 21 days for 10 years and then suddenly it's 6 weeks, then that's something we should probably look into.
Mm-hmm. Sarah's popped in and said, do I need to be careful stopping my estrogen only pill if I have a history of endo? I also have endo, Sarah, so power. She's been on it back to back for years and is getting headaches recently and low.
And is that on the progesterone only pill? Sorry,
yeah.
Did you say?
Yeah.
Yeah. So first thing to say is endometriosis is very common. 10% of women, and a lot of those women will never know that they suffer from it. A lot of women don't get any symptoms. Some unfortunately do. Then the hormonal contraception is really beneficial for it because it prevents those droplets of uterus lining which have gone around the pelvis from becoming thickened and shedding again, which causes the pain.
Okay.
So hormonal contraception is good. If the progesterone only pill isn't working for you anymore, by all means, look at a different one. If you come off it, you may find that you get a bit more of that lining increasing and some more pain. But there's a really, really good patient decision aid, which I use a lot, especially with clients who we've used on the Lowdown. It's, if you search for NICE, which is the National Institute of Clinical Excellence, that's the large body which medics use to teach us the guidelines of what we should do. They have a specific patient decision aid for women who have endometriosis who are trying to decide which hormonal contraception to use. So I'd recommend going and have a really good read of that. It's about 7 or 9 pages long, full of really good information about what might be best for you.
Great. I didn't know that existed.
Yeah.
And like Sarah, I similarly had a kind of weighing up of, you know, mood side effects versus, and it sounds like you've got headaches as well. So we're just constantly adjusting and optimizing, aren't we, as women? The evils.
And that's the thing, something that may have worked for you so well for many years, as you get older and your body changes, you react to it in a different way. Mm-hmm. You have to work out what the quality of life is for you. Is it the side effects from the hormones? Is it the symptoms from the endometriosis? Can you try something which suits you better, which will, you know, treat both?
Yeah. Okay, I'm going to keep going. Is it normal period pain, says Ellie Wilcox, whilst on the Mirena coil? Could this be my womb trying to have a period but preventing it?
Yeah, so that's really interesting. Now, some women, the Mirena suppresses ovulation, so it stops you from releasing an egg, but not in every woman. So the main way it works, the hormonal IUS or Mirena, is by thinning out the womb lining and making the mucus around your cervix really thick so sperm can't get in. And while that's happening, your body's still having a hormonal cycle. It just doesn't bleed every time because the lining of the uterus has got so thin. Now, when you have a cycle, your body releases chemicals called prostaglandins, and they cause cramping in your stomach, like period cramps. So it may well be that your body is still going through the cycle because you're someone who still ovulates and you're still getting the release of those prostaglandins, giving you the cramp.
Fascinating. So it's like a cramp.
Yeah.
That's amazing. I never knew that.
You should also keep an eye out because if it gets really severe, make sure it's not that your coil is moving at all. Make sure you keep checking your threads that it's still there.
Yeah, she says, does the coil move position throughout the cycle? Some months my boyfriend can feel it and others he can't.
Okay. Yeah, you see, so theoretically they sell you the coil that your partner shouldn't be able to feel it.
Yeah.
But a lot of women say that their partners do.
Yeah.
And actually the coil,
because you just throughout your cycle, your threads can sort of like float like tides.
Yeah.
So it could be, you know, your things are relaxing when you're on your period and then growing up.
Yeah, and also your uterus, your womb, it's not a static structure. So, for example, it moves forward and back. It can flop around like this. So if your bladder's really full, it might push it back.
Wow.
If you're full of poo in your rectum, it may push it forward.
Oh my God, I knew that.
So that can affect how the coil would feel. So even though the coil isn't moving, your uterus is.
Yeah, makes sense. I'm just making sure I'm answering people's questions. Elle says, thanks, this is so interesting. Our pleasure. And so does Alice. She says, thanks so much. So helpful. Karis is back. I think, she's the lady who asked the question earlier about mental health and the combined pill. She says she's put on the combined pill back to back to induce the menopause. What are the risks of this? Do you still get symptoms of the menopause?
So which combined pill is it that you're on, Karis? Because it shouldn't be inducing the menopause in you. So if you're back to backing the pill, you're not having a withdrawal bleed.
Yeah.
So you're taking estrogen, progesterone, so you've got a constant level of those hormones in your bloodstream. If you're going through the menopause, then the estrogen level is dropping. So I'd be interested to know, or if you can message and say, what has that been done for, and how have they actually discussed and explained that to you?
Yeah.
It shouldn't be inducing a menopause.
Yeah. Okay. Paige says, what do you think of diet acne?
What do I think of what, sorry?
The pill Dianet. She recently came with it because I felt it stopped working and my acne was coming back. Dianet's one of the newest brand pill, isn't it?
It's an old one, but it's a 4th generation type of progestogen, if that makes sense.
Okay.
Progestogens, we classify them into 1st, 2nd, 3rd, and 4th generation, basically just depending on when they were invented, really. And Dianet contains a type of progesterone which is anti-androgenic, so it's very, very good for the skin. I can never pronounce it. I'm terrible with them, but it's called cyprotone. The problem with Dianet is we now only prescribe it for acne. We don't prescribe it for contraception. And the reason for that is it has a higher risk of causing a blood clot than any of the other combined pills. So we have to be quite careful with it and counsel women properly that, yes, this might be brilliant for your skin, but unfortunately, you will have a higher risk of blood clot. That is still lower than being pregnant or having just had a baby, but it is there. So I tend to recommend Yasmin or Lucette before Dianet for the skin.
Okay. And they're the Yasmin and Lucette, an anti-androgenic progestogen in them.
They're an anti-androgenic progestogen, but it's called drospirenone, so it's a different one, and it's slightly less risk of blood clots than the Dianet one.
Yeah, makes sense.
All very confusing, and it's also very difficult to find this information somewhere if you aren't a healthcare professional.
Oh, I think your mum's on the live. Oh, she says, am I allowed to say I'm a proud mum? Oh,
yes, you are, Mum. You are.
Oh, I love Mum.
She's always encouraged me to talk very openly about sexual health.
Love that. You're amazing at it as well, Fran. You really are. So thank you. I've got an update for Carla on the rollout of the ballerine, which is that intrauterine ball. If anyone's ever heard of it, it's delayed, like most things, due to COVID. Bye, Faith. Thank you. It's been nice having you. Sorry. The IUB has been delayed currently because of COVID. They're still trying to find a price for it, and then they'll roll it out, I expect, like spring 2021.
I really hope so, because it seems like it's going to be a very good alternative for women who do not get on with hormonal contraception. And the problem with the copper coil, which is the only other long-acting, really reliable non-hormonal method, is it causes a lot of pain. And the IUB, they say it causes 10% less pain. So it could be a real winner.
Yeah. But only 10%. You know, I think it's important that clinical study that they've done, not like all gone.
Yeah.
It's It's still there, isn't it?
Yeah, and the heavy bleeding is still going to be a problem.
Yeah.
But then again, it's individual woman, isn't it?
Exactly.
Depends what you want to deal with.
Why do you experience heavier, more painful periods on the coil?
I don't think anyone has worked out the correct mechanism. Again, because why would they? Because it's a really old form of contraception, and it's health. But it's something to do. They've found that women who bleed more heavily with the copper coil have got more blood going through the artery to their uterus.
Oh, interesting.
The mechanism is something to do with that. It's how much blood is going to your uterus. And they wondered whether that might predict which women get heavier bleeding with the copper coil. But that would involve doing quite an invasive ultrasound scan on every woman who was going to go on the copper coil, which unfortunately isn't something we can do at the moment. Again, it would be great if you went for your genetic blood test and your ultrasound to say how would you react to every birth control.
Let me look at a few more questions. Alex Fiend says, I missed the start of this. Will I be able to rewatch it? I don't really know how Instagram works, but I'm sure there's some way we can do something. I tend to look at the younger people in our team. Holly, Holly runs media and can help. But yeah, well, absolutely, Alex. Try and share this in some capacity. Your mum, your brother's here, Andrew. Hi, Andrew.
Andrew, another budding young medic.
Oh, is he?
Yeah. I'm not sure if women's health is his forte at the moment, though.
Oh, amazing. And then, Ms. Franska says, I'm waiting for the ballerine to come out so I can come off the pill. So many women are waiting for it to come out. And Holly social team says you can save it to IGTV when you end. So yeah, I'll do that, whatever that means.
There's dinosaurs here.
I don't know what I'm doing.
I think Sarah has asked, what did I say about that NICE guideline? So it's NICE, NICE, capital letters, endometriosis patient decision aid.
Cool. And we'll definitely do, Sarah, if you can't find it, we'll definitely do a post or something on it because that sounds really useful. So awesome. Thanks, Fran, for confirming that. Okay. Talked about the coil. We haven't talked about the implant yet. A question from Chloe. I currently have my third implant. I've had it for about 1.5 years, and she started regular periods. She didn't before. Not a fan. No one's a fan of irregular periods. I'm wondering if it's working. If it isn't, I still want and need a long form method of contraception. I'm wondering what would it be possible to get a coil fitted?
Yes. It's the short answer. So if you came to see me in my clinic, the first thing I'd want to know is, why have your periods been so well controlled on the implant and then suddenly 18 months into this one just changed? So I always do the triple check, and that is, number one, do a pregnancy test just in case. It's very rare, but just in case. Number two, we would want to do an STI screen. Very, very common, easily treatable, and there can be a cause of irregular bleeding.
Yeah.
Number three, I would always want to bring you in, examine you, and have a look at your cervix, the neck of your womb, because there are certain conditions which can cause more irregular bleeding, like a cervical ectropion, like polyps, and it's just a good idea to have a look at it. And of course, make sure you've had your smear. It's so important, ladies.
Yeah.
If all of those things were normal, this is probably just the implant. Unfortunately, it's a really common cause of irregular bleeding. And I know women who've been stable on it for years, and then suddenly their bleeding's just all over the place. We can't find a reason. It's the implant.
Yeah.
Couple of things you can do. If you are eligible to have the combined pill, you can take the combined pill 3 packs in a row back to back, and that can sometimes resettle the bleeding, stop it, and go back to normal.
Cool.
Or you can quite easily switch to another method depending on your circumstances. The injection can be brilliant for stopping bleeding. And I'm a big fan of the Mirena coil as well.
Cool. So basically, make sure it's nothing else. You're not pregnant. You're not got PCOS. Everything's looking good, and either get it removed or double up for a bit.
Yeah, exactly that. And you know, it's quite easy to switch, and we've been working at the Lowdown on a swapping and switching tool for you, so you can have a look how you go from one to the other quite easily.
Awesome. Talked about the Mirena, about the pill. Fran, is there anything you want to say in terms of, I don't know, what do most women get wrong, or what's the common misconception of contraception?
I think the thing I speak to women about most is the mood. And I have a lot of consultations where women come in and they say, this is the 4th pill I've tried and I still feel awful. And it's quite a difficult consultation, and it's to try and explain to women it's probably not their pill at that point. It's really easy to blame the pill on a lot of problems, and sometimes it isn't. That's the simple thing. And I don't know if a lot of the viewers, I know you certainly have, Alice, there's a book by Dr. Sarah Hill, Your Brain on Birth Control and How the Pill Changes Everything. And a lot of young women who've read that are suddenly very aware of how the pill might be affecting their brain, and it's a real concern for them. So I think that's one of the main preconceptions, that a lot of women are worried that it is changing who they are. And even though there may be some evidence in what Dr. Sarah Hill's saying in her book, I still think the contraceptive pill is one of the greatest things that has happened to women in the last 100 years. And we should try and stick with it and not blame it for everything.
Yeah, absolutely. I mean, but it is a shame that it's not really moved on. But that's not. I think there's an expectation that we've got in our kids, and then we're kind of them, and it's such a shame that there aren't more non-hormonal methods as well, or stopping people getting pregnant.
Or male contraception.
Yeah. Oh, let's not get started. LJ Rigby says, any advice for postpartum women and contraception?
Okay, LJ Rigby. So, I mean, the first thing you have to ask about that is, where are you postpartum, and are you breastfeeding?
What's the difference for postpartum? Is it
6 weeks? Well, any time after birth, but I normally go up to 6 weeks. 6 weeks postpartum. It's because that is when the hospital obstetricians stop looking after the ladies and they come back to me. So it depends on your circumstances. There are some that you can have straight away after you've given birth. So, for example, the copper coil and the Mirena, you can have put in straight away after birth. If it's not within the first 48 hours, you have to wait a while. Progesterone only methods are fine while you're breastfeeding and postpartum. And then depending on your risk for blood clots, so if you had any problems in pregnancy, your weight, if you smoke, you can start the combined pill. Earlier if you're risk-free, a little bit later I'd prefer if you have any of those risks. And there's another method, which I will mention my mum again here, which she says she used after I was born, before she unexpectedly found out she was pregnant with my dear brother Stuart. There is the lactational awareness method, and that is where, if you are breastfeeding and you have to be fully breastfeeding, you can only have a little bit of bottle milk in there, and you don't have periods, you are protected against pregnancy for up to 6 months.
That's great.
It's amazing, isn't it?
Easy.
Yeah. If you think about what's happened in women's evolutionary history to make that a thing, it's quite incredible, isn't it?
Yeah. So is it just that the body's like, look, I got some stuff I've got to do now, like evolution, I die pregnant again or something?
Exactly. Yeah. I'm a cow, I've got to concentrate on this offspring, I can't be getting pregnant with another. So that works. That is fantastic. It's almost 100% effective if you are solely breastfeeding and haven't had a period. As soon as you've had a period, unfortunately, you need something else. And if you start mixed feeding or get more bottles involved, you do have to have something else.
Interesting.
But we love you, brother Stuart, so it's fine.
Awesome. Final question from Banksy from our pre-list. I recently been told by a health nurse after asking to change a pill due to mood, vaginal dryness and zero sex, that I'm likely to experience the same things regardless of the brand of pill that I'm on. Is it true?
No.
Oh.
No, it's not necessarily true. It's, again, what we've touched on. Have you started that pill recently and noticed a quick change? If so, stop it, try a different one. Even if you've been on it for a long time, some women do get side effects later on. It's not going to harm you to try a different pill. I think sometimes, I mean, no disrespect to any of my colleagues, but it can be quite difficult to keep up to date with all of the different pill brands and what might be better for different women. It's a bit of a minefield. Yeah. So if you're worried about that, book in with me and I'm more than happy to go through the different options for you. The app that the Lowdown has developed is a really good tool at trying to work out what might be a better brand for you. So give it a go and see if you can get on top of any of those side effects. Nice little
Fran. Proud of you.
Thanks.
I'm laughing not because of that poor girl's side effects, but because your brothers just commented, was Stuart a mistake then? Which is really...
Stuart was never a mistake. Oh, we love Stuart.
I love it. Stuart's Fran's brother, by the way, for anyone who's just joined us. Awesome. So we talked about, oh no, one more, sorry. Lauren Creek. She's had the Mirena coil fitted at the end of March. She's always suffered from acne and she's now nearly 20. And since April, it's got really bad and she can literally feel her skin breaking out and it's just self-confidence. Oh, I really feel for you, Lauren. I really do. It's horrible having bad skin. And she just says, I want to know if this could be linked to the coil and why my doctors won't listen to me. Yeah. That's something I get angry about, doctors giving things. But anyway,
it could it could definitely be due to the Mirena. Unfortunately, as we mentioned, some women have the systemic, which means all over the body side effects. If you're not happy, it's your body. Don't let anybody tell you what you can and cannot do with your body. If you want the coil out, take it out.
Yeah.
If you want to persist by trying something like what we mentioned, the antibiotics, the adapalene, the Roaccutane, if you get a referral to dermatology, that might all help. But if you're not happy with the Mirena, get the Mirena taken out. Try something different.
Yeah, I always think I think once you've made that decision in your head, you don't like something or you feel like it could be causing something, it's really hard to kind of live with yourself by still using it, you know.
Yeah.
Oh, I hate this, and follow, like, I think women know themselves, like, you know, feel like you need a break from something, or if you want to stop something, don't be afraid, really push for it and make sure that you get
exactly. No one knows you better than you, do you?
Exactly. Right, yeah, I mean, if anyone's got any questions, please pop them in the chat. Don't be shy. I think we're almost done. I've certainly answered all of the questions I think that we had initially. Quickly check our DMs and make sure there's new ones that are in. But yeah, thank you so much, Fran. It's been an absolute pleasure, as per usual.
Yeah, it's delightful to see you, Alice, as always. And it's really nice to be able to have a dialogue with some people who've used the Lowdown.
Oh.
I think I've answered most questions, but there was a couple of people who I needed more information from. So if they wanted to get in touch, then by all means, find me through the Lowdown.
Yeah, exactly. And just slide into our DMs with any other questions or things that people... Stuart's asked one final question. How far along are we on the research for a male contraceptive pill?
Yes, Stuart.
Long way off, aren't we? Still, it's not like the vaccine. We've not pushed it forward that quickly, have we?
I think there was probably a room full of men all signing documents saying that it wasn't actually important or relevant at this time.
Yeah. The male contraception's been like 10 years away for 10 years, so the a long way off. I think there's some trials going on with a gel or something. Edinburgh. A few things are happening, but yeah, it's not soon at all.
I'm just really proud that my brother's volunteered himself.
Look at him. Stuart, would you use it? I don't know why I'm talking to him like he's in the room. I'm interested. And any other...
he's in the room over there, so he's not far away.
Is he in your house?
Yeah.
Oh, is he staying over?
No. So in lockdown, myself, my husband, my brother, we're all living with my parents.
Oh, nice.
Yeah.
Oh, well, that's nice.
Northern family commune.
Well, yeah, much love to the Arlett clan. And thank you so much, Fran. Really enjoyed chatting to you. And thanks for your all of our questions.
Not a problem. It's been fantastic as always, Alice. And I just hope that even if we can just help a couple of people, that it's been worth for them following us and watching this evening.
Yeah, awesome. All right, bye everyone. Have a nice evening.
Bye.
Bye.